we're part of the Learning Health Systems Workstream, and for learning health systems has been a term that's been around in the literature for quite some time, but consumers and stroke survivors might find this a bit of a weird terminology and a bit of a foreign language. And I was trying to think about how we describe this quite in simple terms, but I guess really in its simplest form is really around how health systems make use of data at point of care to drive continuous learning, continuous quality improvement as well. And so I guess it's really about how clinicians a lot of the time are making sense and using and applying data to drive practice improvement. And that can include things like the Australian Stroke Registry, but other data sources and data points as well that are quite commonly available across the health system, but sometimes not readily accessed. And also people maybe not able to make sense of that data, but also use that to drive their quality improvement in their individual units as well. So there's a lot of data around through our electronic health systems. So I think one thing that's really important as well is that clinicians aren't overburdened and overwhelmed by the amount of data that's around, and is presented through things like dashboards in a sort of really meaningful sort of manner as well. But also things around feedback. So we do a lot of audits as well in clinical practice, but how that performance data really is fed back to clinicians in that timely manner and in a format that makes a lot of sense to them, and doing work with them to really understand what can be achieved in terms of behaviour change as well, and really using some of that behaviour change theory and implementation science approaches to. So I think there's a lot of work can be done to really almost empower clinicians at point of care with the data that is available, and really to drive that practice improvement.